Which of the following is our risk factors of acute pelvic inflammatory disease in women? Intercourse during menstruation, multiple sex partners. The umbilical cord normally contains two arteries and one vein. Painless genital ulcer is found in which one of the following genital infections? Lymphogranuloma venerum, LGV. Medical management of tubular ectopic pregnancy can be done in the following except beta HCG level more than 10,000 international unit. Cholestasis may lead to following complications except neonatal jaundice. Which of the following genital infections is associated with preterm labor? Bacterial vaginosis. Multiple pregnancy is associated with an increased incidence of the following except post-date pregnancy. Which of the following conditions of the endometrium is associated with a significantly increased risk of development of cancer? Complex hyperplasia with atypia. Surgical staging is done for all the genital malignancies except gestational trophoblastic neoplasia. B-Lynch suture for atonic postpartum hemorrhage compress the uterus. Regarding Delancey's levels of vaginal support, consider the following pairs. Level 2 supports mid-vagina. Regarding conjoined twins, which of the following statements are true? These are always monozygotic. Most common variety is thoracopagus. The appropriate treatment for the baby of a woman who is HBsAg positive but HBeAg negative. Both active and passive immunization soon after birth. Consider the following pairs regarding fetal heart during labor. Late deceleration results due to any process leading to maternal hypotension, placental insufficiency or excessive uterine activity. 26-year-old woman P1L1 reports with high-grade squamous intraepithelial lesion HGSIL on Pap smear, Papa Nicolau smear. Further management for her is colposcopy and direct biopsy. With reference to the displacement of the uterus, the treatment of choice for genuine stress urinary incontinence is TVTO, mid-urethral tape. Regarding placental separation in third stage of labor, consider the following statements. Separation of placenta occurs at deciduous spongiosa. In Schultz's method, separation of placenta starts at center. In Matthews-Ducan's method, separation begins at margin. 16-year-old girl present with primary amenorrhea with absent vagina, cervix and uterus. In the presence of normal secondary sexual characteristics, ovaries are present on ultrasound. The most probable diagnosis is Mayer-Rokitansky-Kuster-Husser syndrome. A 32-year-old woman is noted to have 1200 cc of blood loss following a spontaneous vaginal delivery and delivery of placenta. The uterine fundus is palpated and noted to be firm. Which of the following is the most likely treatment for this patient? Surgical repair of cervical tear. Which of the following statements are correct regarding physiology of menstruation? LH surge precedes ovulation. There are two peaks in serum estradiol levels. First is follicular, second is luteal phase. Serum progesterone has only one peak, that is in the luteal phase. Which of the following are the measure of dispersion? Standard deviation. Which among the following are examples of premordial prevention? Adopting healthy lifestyles from childhood. The appropriate statistical test to find out obesity as a significant risk factor for breast cancer is chi-square test. In case control study, confounding factors can be minimized by the following except increasing sample size for cases and controls. Which one of the following is false regarding confounding factor in epidemiological studies distributed equally between study and control groups? Denominator in calculation of case fatality rate is total number of cases due to the disease concerned. A well of contaminated water resulting in an epidemic of acute watery diarrhea is a typical example for common source continuous exposure epidemic. An important measure of communicability of a disease is secondary attack rate. Which of the following statements is not correct regarding case fatality rate? Very useful indicator for both acute and chronic diseases. Farmer's lung is caused by the inhalation of grain dust with actinomycetes.